Welcome back, ladies and gentlemen. And after that short break, now we're going to move to the next presentation, the Western Cape Office of the Premier. And the presenter there is Victoria Tully, who's going to lead us in the insights from their province. Over to you, Tully. Victoria.
Hi, Tabo. Good morning, all. Thank you for the opportunity to present the Western Cape contributions in support of the COVID-19 country report. We're looking forward to the discussion over the next 2 days. And I first of all would like to tell you that we are talking to each other from a very wet and rainy Cape Town. So we've got to get on with this and cheer everyone up. Thank you very much as well to Carmel, our colleagues in the Gauteng province. They presented an excellent presentation and also is making my job a lot easier for setting the context for the pandemic. So thank you for the insightful presentation. Okay, so I'd just like to start our presentation. I think at this point, it's important to note that there are several themes that are emerging that you will note in our presentation from the Western Cape that also came through in Gauteng's presentation. So I think as we're piecing together the full story for the country, it's good to look at these themes and to keep them in mind. So just a little reminder there, it's collaboration is an important theme, also being proactive in advance of a pandemic or an emergency. And then thirdly, which was also highlighted by Dr. Pillay earlier in his introduction, being evidence-led. So just a little bit about our background. For our COVID response, we decided to adopt a new methodology for the Western Cape, the rapid assessment methodology. This was because we really knew that we needed to get evidence, we needed to get real-time evidence, and we needed to get it there fast so we could make some decisions. So we took on the rapid assessment. We took on a series of 6 rapid assessments and from the Provincial Data Office. And the one that I will speak about today is the hotspot strategy, which was an overarching structure for coordinating the provincial response to the COVID-19 pandemic. There were 5 other rapid assessments that were undertaken, and they also form the package and also part of our case study. So they were on the Western Cape Safety Plan, also on our humanitarian response with a specific focus on the food relief efforts in the province, and the supply chain work that was done during the time, the disaster preparedness, and economic response as well. So for this case study, looking at our hotspot strategy, the purpose is twofold. Descriptive, by providing details of how the COVID-19 response was managed and what interventions were implemented. And critical, of course, by providing a review of the extent to which the hotspot strategy proved effective as a means of coordinating the COVID-19 response, noting the challenges, successes, and most importantly, the lessons learned. So let me tell you a little bit about the hotspot strategy first. It was designed to focus on and develop integrated intersectoral strategies in 9 clearly demarcated geographical areas in response to the COVID pandemic. So the areas were identified specifically based on the needs of the communities there and also the risk factors. 7 hotspot thematic areas were identified, and these were case management, quarantine and isolation, civil compliance, slowing the spread, humanitarian relief with a specific emphasis on food security, economic recovery, and the 7th was communication, which cuts across the other 6 areas as well. Each theme had several interventions linked to them, and some of these were key drivers for mitigating the COVID-19 spread. The themes are implemented in each hotspot using the Joint District Metro approach, the JDMA, which brought together Western Cape government stakeholders, which included our local government, our municipalities, our City of Cape Town, and then national government and other stakeholders. So a little bit on the background, more in the background, the main assessment has now been finalised. It provides lessons learned to be considered as innovative and practical ways towards improving broader service delivery and readiness for future disasters. And we're now starting to share these lessons and trying to integrate these lessons so that going forward, we can do things better. This discussion will provide a brief overview of the purpose of the assessment, the research and the design, successes, challenges and lessons learned, similar to the case study presented prior by our colleagues in Gauteng. A little bit about our methodology. So how was the hotspot strategy designed? How did it find expression in the implementation of the interventions? This is a key overarching question. To what extent did the hotspot strategy facilitate a whole of government approach, which I mentioned earlier with the stakeholders, WOGA, and a whole of society approach, WOSA, in slowing the spread of the virus while responding to the associated and ongoing risks? And what was the role of data and evidence in enabling the hotspot strategy? So I think at this point it's important to mention that Western Cape Government is very much moving towards being a data-driven organisation, because we realise that data and evidence is the future, and managing that to make better decisions and to offer a better response and better service delivery going forward. A little bit more about the methodology. So the disaster risk management framework was utilised as the theoretical framework. And if you're not familiar with the framework, it's a framework that looks at mitigation and preparedness, and then it looks at the response, and then it will look at the recovery. So we try to apply this to the hotspot areas. And then this case study, as I mentioned, was the sixth of a set of assessments, and they were conducted in the first 9 months of the COVID-19 pandemic. So these assessments are all complete in themselves, and then there's a synthesis, and then obviously the hotspot strategy brings them together as well. The data collection that we used, we did data and document review of all available data and documents that we had, online interviews as well, and focus groups. And we also utilised online survey methodology. From this amount of data, we brought it together, synthesised and triangulated to tell the story. So first of all, let's talk about the findings. So the effectiveness of the interventions, once again, data and evidence came to the fore. I'm just going to describe a couple of examples where we can demonstrate this. So our Department of Health have a single patient view, the SPV database. The hotspot teams were kept up to date with the progression of the pandemic, and they could tailor the responses accordingly. The data on the SPV was live, it was accurate, and it was real. So at any point in time, the Department of Health provided us with this data, and all of the province who was involved and our whole of government, we could see where we were at any point in time. Alongside this, the Unity system, it allowed users to enter and access data disaggregated down to facility level in real time, so that available rooms and beds could be tracked. Also very, very critical when you have to move patients or cases around, so they knew exactly where we were in real time. The social economic vulnerability assessment, this was actually very interesting. We realised that there was no reliable representation of data on the socioeconomic impact of lockdown restrictions on the vulnerable. I suppose none of us did, it was new to us at the time. So the Provincial Data Office used available data to generate a socioeconomic vulnerability assessment for each hotspot area to assist in targeting the most vulnerable groups in society. So how this practically worked was that we realised that through a lot of the relief that was being offered and a lot of the support and services and innovation that was being offered, it was very difficult when we were trying to target individuals who perhaps needed a food parcel, were very much in need of a food parcel. It was much more effective to identify an area where there were a group of vulnerable people and then offer them support and what they needed there. Many interventions lacked verifiable data, outcome level. I don't think this is unusual in South Africa. I think a lot of the provinces will report this. Hotspot stakeholders' perceptions of the interventions that were undertaken were largely positive. And the evidence indicates that the interventions impacted positively in stopping and minimising the spread of COVID. I think maybe at this point it would be useful for me to share with you some of the interventions. I can't share them all, and there was some great work done, so I don't want to offend anyone by just selecting a few. But a couple of the standout interventions, innovative interventions in the Western Cape were we introduced a red dot taxi service. And the purpose of this service was to transport citizens between their homes and quarantine and isolation facilities or hospitals. It was very, very important and very much utilised. It was also utilised to transport healthcare workers and then had the added benefit of being highly sanitised and highly controlled as well. There was another excellent innovation that is worthy of mentioning, whereby medicines were distributed to the home in some of our communities by bicycle courier. This, of course, meant that citizens did not have to go and queue in long queues and then risk exposure to COVID as well. And then the other area where we also saw some great innovation was in the community food gardens. So as you know, in the humanitarian relief, the need for food and feeding was very much at the forefront during the pandemic, as it still is. And our Department of Agriculture was involved in the establishment of some support to some community food gardens. And they were supplying some of the local food kitchens in the areas and schools. And that provided quite a big need and was deemed very effective as well. So on the other side, looking at the data and evidence, of course, there was a gap in the data. There's always going to be a gap. But one of the areas we noticed there was a gap in was for the intermediate measures, measuring social distancing and the adoption of hand hygiene and the wearing of masks. We did manage to do some research in some of our sites on the wearing of masks, but we really felt that we could do better in collecting more data there going forward. So just continuing with our findings and the effectiveness of the hotspot strategy. Powerful new experiences of collaboration have given many government officials a renewed sense of appreciation for what can be achieved through the WOGA, the whole of government approach. So looking first of all at the whole of government approach, and then we'll look at the whole of society approach. So the whole of government approach, there was a lot of positivity around intergovernmental collaboration. I think we'd waited a while for that in some areas. High levels of agility, which definitely helped us, assisted us. Successful in slowing and managing the spread, the collaboration certainly did help. We were unable to shield all people from the economic risk and hardship. That was all over. Pre-existing relationships were central to the effectiveness of the collaborations. And more still needs to be done to give full expression to the whole of government approach, including improving protocols for stakeholder involvement. So let me talk a little about the WOSA, the whole of society approach. This is where it really gets interesting. There was a variable extent of collaboration with non-government role players. 4 of the 9 hotspots had no civil community stakeholders in their hotspot teams. Rigid governmental bureaucracy linked activities to budgets and hampered meaningful full collaboration in many cases, but better planning is needed. We noted that the whole of society approach and the integrative approach with communities really was necessary at a time of crisis. And this is a big learning for us. So let's talk about what worked well. So as I mentioned, pre-existing initiatives, they laid the groundwork for the success of the strategy, such as responses to floods, wildfires, and more recently the water crisis in the Western Cape, known as Day Zero. So these structures were there and they were useful to tap into how these strategies had approached these crises and then use that to respond to some of the C19 requirements. The sense of urgency and business unusual, it allowed for a much more quicker and a more comprehensive collaboration between partners. We knew that we had to respond fast, we knew that the citizens needed answers fast, and we knew we had to be active. Sometimes things in government take a little bit longer than that. Strong collective leadership was key. Our heads of department were chairing the hotspot teams, and a lot of senior leaders were involved. This meant that we had the right people in the room and decisions could be made there and then. It can happen in government that there needs to be a task force, maybe 25 emails, a couple of letters, maybe a steering committee as well. So it was wonderful that through the strategy, having the right people in the room, those decisions could be made there and then, very, very proactive. Information and communication was critical, and the meetings facilitated the sharing of the data and information. So everyone was on the same page regarding where we were at with our numbers, our figures, how many people in isolation, what facilities were available, and the uptake and use of the facilities, the uptake and use maybe of the Red Dot taxi service. So all that information was live and in real time and at our fingertips. All that evidence was there. Current available data and information was analysed and shared through the hotspot structures. We got it out there. And remember, this wasn't just government. There were also community and other members of society there as well, which was really important. It was wider than that. There was freedom to implement the hotspot strategy, and it was due to the adaptive government approach. There were many co-learning opportunities that opened up through sharing within the structures. We could learn from each other. We could learn from each other's mistakes as well. Collaboration and cooperation, in more practical terms, was achieved through the design in itself, bringing people together, having the right people there, having the data at your fingertips. All the things that has taken many, many, many years to try and get on the table seem to really come together in many ways because of this pandemic. What do we need to do differently? Well, there'll always be lessons learned. So it's no secret that government structures can be siloed and fragmented, and in some cases they definitely still do exist. Structural constraints still exist, and they're often linked to national governance structures. Capacity concerns regarding the marrying of allocated mandates combined with an out-of-the-box, dynamic or innovative way of working together. Sometimes it happened that there was inconsistency and inconsistent attendance of the key departments, which were considered essential to the success of the hotspot strategy. So we needed to have the right people around the table and in attendance and reporting on the 7 areas at all times so that we could maximise the benefit of the collaboration. Pandemic fatigue, I think we all suffered from that at one point. So officials are expected to maintain some components of their COVID-19 response while also resuming components of their mandated responsibilities. I don't think I'm alone when I say people just got tired. It was definitely hard work. And then towards the end of the peaks, the scaling down of the frequency of the cabinet and hotspot meetings. So there was a need, obviously, to scale down, and it may be seen as an example of adaptive management. However, the lower frequency of meetings may reduce the timeliness of the hotspot team's response. So what happened in the Western Cape, some of the hotspots continued to meet and continued to collaborate and continued to share their data. But often the emphasis moved a little bit more towards the recovery plan because of the phase that we were in. So what do we need to do? So challenges in the implementation of the strategy. The strength of prior relationships, as I mentioned, was key as it becomes difficult to forge the required levels of trust and camaraderie between participants in a short space of time. We needed to work on our existing relationships and to build that trust, particularly when it comes to the whole of society approach. We can't just walk into our communities and decide, okay, this is what we're going to do. If we have an existing relationship, existing collaboration there, it's going to be a lot of a smoother ride for everyone. The nature of collaboration between the partners in the hotspot, also critically important. The NGO sector, I know that Carmel mentioned this earlier as well, and the good work that was done in the NGO sector, particularly with regard to the humanitarian and the food relief. It raised the challenge around the continuation of the good structures, the goodwill and the relationships beyond the disaster phase. We need to harness these, we need to maintain these collaborations and this support. Government can't do everything by themselves. They definitely can't. And our humanitarian crisis in South Africa continues. These areas still remain vulnerable. Maintaining effective internal and cross-sectoral communication between stakeholders, absolutely critical. And very, very importantly, linking it to the current situation on the ground. So once again, linking it to real time. What are the real needs? We need to keep that collaboration going strong. Key lessons. What are we going to take forward? Well, the hotspot strategy and the joint district metro approach, it proved worthwhile and responsive. That's the good news. The importance of senior leadership was definitely key. It really drove the strategy in the end. The buy-in needed to be there, and it was there, and we all pulled together. Ensuring that membership is aligned to the objectives of the reporting structure. So we had the seven areas, the themes, and we really needed to make sure that each of those themes were addressed and the communication was there and the data was able to be shared to move forward in those areas. Very, very critical and linked to the importance of data and evidence are pre-existing data capabilities. Where they existed really became game changers for the Western Cape. There was an establishment of a number of dashboards, a humanitarian dashboard where at any point in real time, one could view where the parcels, food parcels were being distributed, where the school meals were being distributed, and also where the soup kitchens were operating from. Similarly, the main COVID-19 dashboard for the cases in the areas and the recoveries and also the quarantine and isolation. The brilliance of these dashboards is also that because the pre-existing data capabilities were there, but also these capabilities could be expanded. And going forward now, we're busy developing, and I think it's piloting at the moment, a vaccine dashboard along the same lines, where you can see in real time what is actually happening on the ground. Linked to this closely, the benefits of investing in strengthening data assets and platforms for sharing the relevant data. Close to all our hearts, adaptive monitoring and evaluation approach. Definitely, we need to do better. The whole of society approach. It does appear harder to facilitate than the whole of government approach, but it holds great promise. We need to bring our communities closer. We need to bring civil society closer. We need to bring the private sector closer. We cannot do everything on our own. Regulations and institutional culture often hinder collaboration. Building relationships is really crucial before disaster strikes. We cannot go in there when things are really not looking great and try to call all the shots or run the show. We need to have relationships so we can work successfully and collaboratively before the disaster strikes. And also linked to that, tailor and co-creation of interventions for communities. We need to work with our communities. We need to work with them on the interventions that they need. It'll ensure buy-in, but it'll also ensure much better service delivery in the long run. So that actually concludes what we wanted to say today in the Western Cape. So just to leave you on a note, collaboration, definitely, team efforts, WOGA and WOSA. I think echoing what Dr. Pillay said earlier on, we need to be proactive. We need to be evidence-led. Certainly our case study has shown us this is really, really critical. And also we need to be innovative in our thinking and to do things slightly differently as we did. And really, I think during the time, in many, many areas, we almost got a couple of years work done in a couple of weeks, and most of it hopefully to benefit the citizen in the communities. Thank you.
Thank you very much, Victoria. And it's very clear that there are some themes that are already emerging when you compare your presentation with that one from Gauteng province. There are some interesting questions coming from the delegates online. They would like to know what data was used to track emerging cases spatially.
Hi, thank you. Thank you for the question. Yeah, the data was used from the department, so it would have been data from testing and people going for tests and positive tests. And then if people were admitted then into hospital or quarantine and isolation. So all of the data was through the Department of Health's systems, data systems.
Okay, no, thank you very much for that insight. How did you manage the pandemic fatigue?
Oh, I don't know. I still feel a bit tired. I don't know about you, Tabo, but definitely. Look, I think, it goes back once again to collaborate and building your partnerships and supporting each other as best we could, certainly in our team in the Provincial Data Office, we tried to debrief, we tried to support each other where we could, and we weren't afraid to ask for help and support from other colleagues when we needed it, So, nobody really gave up. We just kept going.
No, of course, we all have to keep going, even when the new cases are emerging. It looks so like true. The hotspot strategy worked very well for you. Is this only unique to the Western Cape, or there are other provinces that have adopted a similar approach?
Well, I can just really answer from our own side. It was something that was developed in the Western Cape, where you would use the identified area and then the collaborative approach of WOGA and WOSA within that. But I would have to actually maybe ask our colleagues from DPME if they are aware of any other provinces who adopted a similar approach.
Great. Thank you, Victoria. I have no doubt Mr. Godfrey here will address that one.
Yes, we do have examples that were shared. I think the example that we cited earlier of Gauteng with the GCRO, where they could actually zoom into locations and understand the levels of vulnerabilities, which they use to adapt the interventions to various places. The Eastern Cape also has shared some examples. I'm sure when they speak later on, they will share more information on that aspect. I think there are examples of that across the country. Thank you.
Thank you. One of the major themes that's coming across is the use of data in managing the crisis. You mentioned the SPV database that seems to enable you to manage the situation more efficiently. Right. Are there other capabilities that technology can bring to the fore going forward?
Yes, I think, the whole idea and the whole key to managing the crisis is being able to have real-time live data. And this is what the databases definitely did. It allowed the departments to see how things were like on this day at this time, so that they could manage their resources where they needed to put them at the time as well. I think this type of real-time data and databases seems to be where really critical and where it's at when managing a crisis. So yeah, I do think there's great potential going forward using the same methodologies and the same types of evidence, definitely for dealing with pandemics and future disasters.
Great, great. Like we say, major themes are emerging. And you did mention collaboration, although in most cases we're talking about collaboration with the key stakeholders external, perhaps to the department or to the division. However, there is also collaboration amongst the various government departments or divisions. How do you see that collaboration, or what has been your experience in getting the various components within your province working together in addressing this pandemic?
Yes, well, Tabo, the hot strategy was a brilliant opportunity to do that. You know, to bring our departments into the same room. So at each of our meetings, we would have, you know, our Department of Health who would be reporting on the cases, and then we would have our Department of Transport and Public's Work who would be reporting, say, on the red dot taxi service and the utility, the uptake and use there, and the quarantine and isolation facilities. And then we would have our Department of Economic Development, and they would be reporting on, you know, the business support and helping the economic recovery there as well. And, you know, so all the departments had a role reporting on the different themes. So it forced us to move into the room together, work together, support each other and share. And, you know, it was quite interesting because as a government, and I don't think it's unusual for the Western Cape, we don't often have opportunities where we all work very closely together on the same topic, even though essentially we're all working for the same province at the same time.
Okay. Oh, thank you very much for those insights. Of interest to me is the principle of WOSA, the whole society approach. Could you please elaborate on that as to what has been key to making that successful?
Yes, as I mentioned earlier, you know, it's been absolutely incredible to see the response from civil society and the private sector, you know, in supporting the pandemic and the pandemic response, particularly in the area of humanitarian relief. It really is, you know, government working hand in hand with the communities, with the community representatives, and, you know, opening that door for that level of collaboration, not just giving out or handing out something, but actually listening and sharing and learning from the communities who know the communities are more than anyone else. So it was really based around that. In the Western Cape, we actually set up, in collaboration, an NGO forum where the NGOs could sit around the table, and we had an interface, the Economic Development Partnership, who actually acted as an interface for the partnerships there, so that we could hear and learn as well what the people were doing and what the community were doing in the communities, and then government then could support those efforts as well as contribute to them. So yes, it's all about listening as well as doing. To build those partnerships and relationships.
Great, thank you. Just as a follow-up to the issue of using of data to track the emerging cases, the follow-up question there is, did you do any geocoding of the NICD line list, and how did you react to this?
I'm not actually aware of that particular detail, but I do know that there definitely was geocoding done on the cases because of our dashboards. So I would have to refer the specifics of that question to one of our geospatial analysts. But definitely we did do a lot of identification of the cases geographically, because they were plotted, you know, on our COVID-19 dashboards, and the information was all available there as well, live.
All right. In a similar pattern, going back to the SPV database as a follow-up, do you see that being used as interprovincially by any chance? And if so, how?
Yeah, look, I think it was a great initiative and a great opportunity, you know, to, as I said, get the real-time data to find out what was happening. And I'm sure that type of database and software would and could and should be used interprovincially and by other provinces as well. As I said, it is a database that resides in the Department of Health, so they would be able to provide more information on that.
All right, you want to make some comments there, Mr. Godfrey?
Yeah. No, I wanted to make a comment around the collaborations that you have cited in the presentation. That there are innovations that come with those through the crisis. I think at various levels of government we were forced to form new forms of collaborating or working together, building on top of what you've termed to be pre-existing relationships or pre-existing structures. That the challenge then going forward is how do you now embed these new practices into the way that the government works, but also how do we take these lessons and get rid of inefficient processes going forward? I think that's a very, very important aspect from what I pick up from your presentation. Thank you.
Great. Oh, thank you very much for that. And Victoria, you highlighted that some of the things that came up was the lack of reliable data, even perhaps as a situation that existed prior to COVID. Now, we are gaining those lessons that we need to polish our data, make sure that it's up to date. So what are the plans when it comes to making sure the data is up to date?
Yes, I think it's a very, very good question, Taba. We are busy, as a province, working towards really improving our data capabilities. So we're working, and we have established a provincial data office. We're looking at data quality. We're establishing all sorts of new systems so that we can harness the power of the data. First of all, the data that we have, but also in government, there is some hidden data as well. So to try and bring that to the fore, to do data discovery, to identify the data. And then over on this journey, which we've been on for a few years now, things improve and things progress as time goes on. But it is a journey and it will take time. You've got to look at quality, you've got to look at standards. There's even legal aspects as well when you're dealing with data. So yeah, our data journey has begun and we're excited about it. And we think going forward, things can only improve. Thank you.
Great. As a last question, there's an issue around collective leadership. What lessons can we get from that when it comes to collective leadership, given that the situation called for lots of hands on deck?
Yes, I think this is such a key point, definitely. It's about, as we mentioned, and also as our colleagues in Gauteng mentioned, it's about the collaboration. It's about the partnerships. It's about harnessing the previous, partnerships that you've established and the relationships you've established. It's about buy-in from our seniors as well, our HODs, our Premier, of course, and buy-in from the top as well. And once we have all of that, we can work on building good relationships and taking it forward,
Great, thank you. I guess Mr. Godfrey also would like to comment, sitting nationally, how you coordinate all the different provinces from a collective leadership point of view.
Yes, I think the structures at the nut joints, with the different structures that actually supported the work of the National Coronavirus Coordination Council, there was a whole range of structures that were created. I indicated earlier that the system that operated was that it enabled interaction on a continuous basis in very short space of turnaround times for meetings to be held, for issues to be discussed, surfaced and resolved, and decisions to be made far quicker, and action deployed far quicker than it would be done before COVID. I think we have learned quite a lot from the crisis itself by doing that. Then the other issue that I wanted to comment on was the adaptive M&E approaches that you were using. I was keen to hear a little bit more about how practically did you execute that? The adaptive M&E approaches.
Certainly, yes, thank you. I think, first of all, it comes back to the data question. It was simply, going back to old-fashioned M&E and really monitoring and keeping your records and keeping your data and tracking, your interventions. So you actually have that information. But on the other side, also for us, it was very new to get involved in rapid evaluations and rapid assessments. And going to the story again, where data is needed now, normally evaluations would take us up to maybe 18 months, 12 to 18 months, a full-scale evaluation. But when we adopted the rapid methodology, we were able to do good evaluations, not full-scale, but good evaluations that gave us some good credible findings, robust findings within about 16 to 20 weeks, which was really beneficial at the time of the crisis, at the time of the pandemic, to be able to get some results there. So big learnings for us was definitely adopting new methodologies, such as the rapid evaluation methodology, and also looking for data that maybe wasn't collected before on the interventions, and then being able to track that data as well, which wasn't perhaps tracked before as well, to feed into the hotspot engagements.
Okay.
Great.
Thank you. I think there are some very important lessons to pick up from that approach for various aspects of government processes. The use of rapid evaluations to be able to assess the situation very quickly and pick up lessons on how things can be improved in a very short space of time to feed into policy processes. Thank you very much.
Great. Thank you very much, Victoria, for all those insights and your response to the questions. Much appreciated.
Thank you very much for the opportunity.
Great.
Thank you.
Thank you.